Today, we are going to talk about opioid overdose and the purpose of naloxone. We will be covering a wide range of topics as listed here. Naloxone, also known as Narcan, works to reverse opioid overdose or prevent respiratory depression due to an opioid overdose. You would administer naloxone in 4 to 8 milligram doses when someone is going through an opioid overdose. It is a pure opioid receptor antagonist, which means it prevents the opioid from binding at the opioid receptors by taking its place. It takes about 2 to 15 minutes to start working and lasts for about 30 minutes when using the nasal version. There is also an intramuscular option, but it is administered by healthcare professionals in an injectable EpiPen version called a Vizio, which you can get through prescription. So what is an opioid overdose? An opioid overdose is classified by an excessive dose of opioids. This typically occurs due to having too high of a dose, typically through misusing someone's medication, accidentally taking an extra dose, or mixing opioids with alcohol or other medications, prescription or over-the-counter. This also includes products that may have been laced by an opioid. Some symptoms of an opioid overdose are clammy skin, paleness, blue or purple fingernails, vomiting or gurgling noises, and slower breathing and heartbeat. If you come across someone who you suspect is having an opioid overdose, follow these steps. 1. Survey the scene. Look around for anything that may look like drugs, anything that may give you context on the situation, or anything that could harm you. If the scene could put you in more danger, call EMS and do not approach the individual. Your safety still comes first, even when you are helping someone else. 2. If the scene is safe, check the person for responsiveness. You can tap them on the shoulder or ask if they can hear you. 3. Call 911 and emergency medical services. 4. If you have naloxone on hand, you should administer it now. If you are trained in CPR, you can also begin compressions and perform rescue breaths. 5. Place the individual in the recovery position. You will place them on their side, with their top knee bent at 90 degrees, arms supporting their head. 6. Stay with the individual until EMS arrives to take over. In order to use naloxone, follow lay, spray, and stay. Call 911, then lay the person down and tilt their head up. Insert the device into their nose and press down the plunger to spray. Then, stay on site until EMS is available to come and put the person in the recovery position. Keep a safe distance from the individual in case they wake up agitated. If you have additional naloxone doses available, you may give more doses every 2 to 3 minutes in alternating nostrils until EMS arrives. Please note that even if you aren't sure that the person is suffering from an opioid overdose, giving them naloxone will not hurt them. It is better to be safe than sorry. When you administer naloxone, you are protected by the Good Samaritan Law. This is a law that was created in Connecticut to protect those who act in good faith to help someone going through a medical emergency. This includes administering naloxone. You cannot be held liable for providing proper care or for possessing or being under the influence of drugs when calling 911 about a drug overdose. Please note that while this still applies at a state level, you could still face repercussion through the Yukon system. It is judged on an individual basis. Please don't let this stop you from providing care. So why care? Despite making a lot of progress around opioid overdose and education, many people are still affected by opioid addiction and opioid overdose. If we look at data from the CDC, more people are affected by opioid overdose in Connecticut than nationally. In addition, most of the abuse is coming from prescription medication. It is important to be aware of opioid overdoses and the steps to take because you never know who you are going to come across who could be impacted by opioid abuse. If you have any more questions, here are some good resources to find more information about naloxone. Also, please don't hesitate to call Student Health and Wellness if you have any questions. If you have an emergency, please call 911 first. However, our pharmacists are naloxone certified and would love to have a conversation with you. They can also prescribe naloxone if that is something you are interested in as well. Student Health and Wellness also has plenty of recovery support services available, including the Yukon Recovery Community, if you or a loved one would like additional support. Thanks for listening to our presentation. We hope this provides you with more information on naloxone and its use. In the unfortunate event that you encounter an opioid overdose, we hope our video has prepared you with the information to help support in whatever way you are comfortable.